Well, good morning, Dr. Marquez. I really appreciate you being on with me today. I'm excited to learn more about your practice, and I'm sure other people will be as well. But today I have Dr. Marquez with me. She is the owner of Ponte Vedra Family Medicine here in Ponte Vedra, kind of right off of Phillips Highway, right?
Yes.
Perfect. Well, I appreciate you joining. Tell me a little bit about you and your practice.
Thanks so much for having me. I really
Yeah.
appreciate that. So my practice is a direct primary care practice, and I really just enjoy the freedom of not being bound by insurance contracts. So the way that I practice medicine, even when I was in employed medicine, taking insurance, I like to spend a lot of time with my patients. I like to hear kind of
Love
all of their concerns and address all of them and not kind of limit to a small number of problems or say, I only have 15 minutes for you today. That's just not really the way that I practice medicine. And so I have ventured out this year. I opened in January and
it.
started a primary care practice. And so, for those who don't know, that's a cash based, non insurance based membership practice. So, my patients enjoy unlimited visits with me.
Yeah.
So if I have a patient, for example, I had one recently who was very sick, who needed follow-ups every week. She
Mhm.
wasn't having to pay for all of those visits. Her 1 month payment paid for all of those visits, as well as any point of care testing or things that we did in the office. So um, they also enjoy unlimited access to me. So that's texting, phone calls, video messaging as well. So it's kind of a fun way to practice. I like to look at it as going back to old school medicine more than like a
Sure.
new thing.
Sure. I think that's awesome. I've had my practice for about, 3 years or whatever, and I'm the same as you. Like you being able to get out there in front of the person, have the relationship-based care. And I feel like that's what they're looking for now in medicine. People are becoming more and more educated and they realize like, hey, like my primary care doctor should be doing this with me, but they have 12 minutes, that's just the
Right.
way it is. Yeah,
Right.
and I feel like a lot of people don't understand that in the insurance realm, the insurance company is your customer. Like that's who you're trying to please to get paid.
Unfortunately, that's true, and I
Yeah.
I try to help people understand that regularly, that, to have mercy on their physician
Yeah,
friends or doctors that they see
yeah,
in the system, because they're being told how to practice medicine from the outside, from the insurance industry, and they're
mhm,
being told whether or not they can get paid based on those contracts. And
yeah,
I love that I can walk into a visit now and I don't have a personal agenda, because I'm not having that pressure from behind me anymore.
yep,
Walk in and say, okay, why are you here? What is it
yeah,
that you need accomplished today?
yeah.
Nothing to do with me. And that's great.
Yeah, I feel like we've all heard those frustrations of the waits in the waiting room, and then they send a message to their physician and they don't hear back and they have questions. And people are kind of expecting difference, but unfortunately, the insurance company doesn't pay for that stuff, right? And so you're just asking the physicians to keep bending and bending, and you're noticing more and more going out on their own, especially the really talented ones. And so I really appreciate what you're doing in direct primary care practice. I think, some of the questions that people have that I often get are, how do people pay for this? Like, what are the barriers for payment? What does that look like?
Yeah, yeah. So, some people will look at it because we're used to the insurance system, right? So
Yeah.
they look at it like, how can people afford that? It's extra money. It sounds absurd. But if you look at most of the current insurance programs, you're going to have a high deductible plan, which means you're going to pay a copay to see the doctor, and then you're also going to get billed the balance because you haven't met the deductible yet. So again, if a membership in my practice for one individual is 200, and it comes down based on how many members are in the family. So
Yeah.
for a two-person, it's 325. It doesn't double. So they might look at that number and say, like, that seems like a lot. But if you're paying that much every visit that you go to the doctor, and if you go twice, again, if you're sick and you go for a sick visit and then you need a
Yeah.
follow-up a week
Yep.
later or 2 weeks later, then you're paying double.
Yep.
And so, and there's no nickel and diming. So my practice also includes, if you need a test done in the office, like a strep test, you're not getting billed for that test in addition to the visit. Again, that's included. Minor procedures that I might do, whether that's, joint injections or biopsies and things of that nature, it's not an extra bill. So it's not all these extra fees
Sure.
that get added on top. So it ends up being usually less than what people are paying in their deductible anyways.
Mhm.
Some insurance companies will allow patients to ask for reimbursement for membership. So
Mhm.
that also can be a benefit too if, you're paying for it through your HSA or you ask for reimbursement
Okay.
in your membership for your membership and the insurance company will allow that.
Yeah, I've had a lot of success with people getting reimbursed with FSA and HSA. I mean, I think those funds are there for that reason. But I think a lot of more people are getting involved in proactive care as well. And how can you expect somebody to take care of your physical health in 12 to 15 minutes when now that appointment with you, they can get that done. And so I think it's important to know that people healthy as well could be a part of your practice,
Absolutely. Yep.
or quote unquote healthy, right? When they believe
Sure.
everything is going very well. Yeah. Yeah, so you're located, you just opened in January, and where are you located?
So I am, if people are in the area, Ponte Vedra, I'm just south of Nice High School off of US 1. There's a little plaza here. The first time I thought it seemed like a really random location, but it's pretty great. We are
Oh,
not far from the beach walk, from the Bartram, from the beaches. Even St. Augustine patients come up, and plenty of Jacksonville as well. So it's a good location.
great. Yeah, it is a good location, and you got a lot of building there as well, and you're pretty close to 210. So,
Yep.
um, and tell me, like, so what's your ideal client or member look like?
Okay. So I am one of those doctors who just can't really narrow it down.
Okay. Yeah.
I love to see everything. So
Yeah.
I have plenty of healthy patients who come in for their physicals and then for sick visits, and they like the convenience of being able to text and say, "Hey, I'm not feeling well. What do I do?" And
Yeah.
I can either
Yeah.
say, "Hey, come in today." I keep same and next day availability for my patients so that it's easy. They're not having to go to urgent care or something.
Mm,
Um,
mm,
and so I like just healthy patients, but I also really like being able to spend the time with people who in a lot of primary care settings don't get the care that they need because they are complicated. And
mhm,
so I'm not afraid to block off an hour or 2 hours for a patient that I know has a very significant medical history that
mhm.
we can kind of work through those things. I mean, is it magic that I can just, fix them in one visit? Of course not,
Yeah, yeah, yeah.
being able to not feel like they have to keep coming back and only making millimeters of progress, we can kind of work through things in a better fashion just because I have the time to do that.
Yeah, that's great. And I feel that a lot of, let's say, preventable diseases and other things can be truly prevented with the proper amount of education and the front end. And so I think it's important people to know that, when they work with someone like yourself or me, like we're thinking down the road too of like, hey, you're starting to show signs of this. Not a huge issue now, but like we need to stay in front of it, and this is how we do it. And unfortunately, like I haven't seen that happen in a traditional primary care practice.
Right, it's a lot harder. I love preventative medicine. It's always been, a big part of how I practice, and nutrition, exercise, all of those, health building things, that's hard to incorporate into regular practice,
Mhm.
when you're
Mhm.
in an insurance-based system. So it is fun to be able to take the time and educate patients in that way so that their health truly becomes theirs to manage. It's not that I'm managing it, but that they can take that ownership. And I love that.
Yeah, I think that's really important, making the patient at the center of their care and the center of this decision making. And we're noticing that shift in the healthcare system as well. But I think that's really neat, really, really neat. I feel that people, once they have their first visit or try it for the first time, they're really hooked and like they really enjoy that experience.
Yeah.
I've heard that from many, many people in the area. So I think it's important people know, like, yeah, you have the traditional insurance, it's there for catastrophic events.
Mhm.
We kind of have to hold on to that just because of our healthcare system the way it is. But when you're looking for somebody that wants to take care of your health now and later, like a lot of this stuff can be prevented if you just stay ahead of it.
Right.
And so you're there for the once in a while urgent care visit, like if they need a stitch or something, and then you're also there if they're having some issues managing their diabetes and their cholesterol, and those types of things as well.
Absolutely. Yep. I do a lot of weight loss too. I kind of consider that slightly preventative, slightly chronic,
Yeah,
just because obviously you probably see this too. Once we see patients reach certain weight levels, then they're looking at cholesterol issues
yeah,
and cardiovascular issues, diabetes, all of those things. So I like to kind of address that before it becomes a big issue. I like to tell my patients when they come in and ask about weight loss, I'm like, I just want you to know I've been practicing weight loss before it was popular. This
Yeah,
has long been a part of my practice. I
yeah,
really enjoy it. And there's no shame. We all have had struggles staying with our health goals or getting off track or letting just the stress of life, get to us. And so I really enjoy helping patients on that journey as well.
yeah, that's amazing. I can echo a lot of that, and I've seen that in the direct primary care practices where they can just kind of walk alongside that patient throughout that journey, because a lot of these things that we're trying to tackle don't takes a lot more than a 12 or 15-minute appointment, and it takes time and it takes a lot of effort. And these behavioral and habit changes are just they're tough to do on your own. They're really, really tough. And so having really good providers next to you to be able to help you do that is key. I mean, that's how we're going to tackle some of this stuff. So I
Yeah,
appreciate you saying that and doing that with your patients. And it's definitely not the easy route, but it's definitely a route worth going down.
sure.
That's amazing. So you work with the weight loss clients. Who else are the people that you love in treating?
Oh man. I do a lot of depression.
Oh,
Um,
okay.
a lot of depression and anxiety treatment.
Okay. Okay.
Unfortunately, just with the amount of stress that we see
Yeah.
um, as Americans, we don't have the healthiest lifestyles.
Sure. Sure.
um, Work-life balance, those kinds of things. And so I do see a lot of that. Um, so I wouldn't necessarily say like it's my go-to patient, but I see a lot
Yeah.
of them, a lot of experience, and I have a lot of compassion just
Sure.
from the number of years that I've been treating patients with
Yeah.
depression and anxiety. So I would say that's another thing that I do a lot of. And then, yeah, just general care. I love pediatrics. So I do still see children. Some people forget that family doctors see kids. And so
Yeah. Yeah.
I do see all ages of kids. And so I love when families join. It just makes their life so
Yeah.
easy. Mom can call and say, hey, we're due for our physical. And I can just bring all their kids in, whether they have two, whether
Yeah.
four. It doesn't bother me, to have kids in the office. I love it. It gives me a little bit of a change, from the day.
Yeah.
So yeah, I would say that's probably two of my other favorites.
Awesome. Yeah, that's really good to know. I think the like the mental health just comes along with more time with their clients too. Like,
Mhm.
when you're with that person for such a long time and being an empathetic ear, you're starting to dabble into some of that stuff. And it's just nice to have more and more people at least addressing that. Because I don't know about you, like when I was in the clinic, we would screen. Yeah, you have a couple questionnaire screening, and then it'd be like, oh, okay, you're showing signs of this. Go see this person. That's kind of where it ends. And they're in charge of doing that. But being a part of direct primary care, you're part of, recognizing that stuff. And if you can't take care of it, I'm sure you're really good at, designating those referrals and reaching out to people if needed.
Yep. We have a lot of great resources for
Perfect.
that. So yes, I manage what I can in office, and then
Mhm.
patients who are more complicated, I definitely get referrals. And then, whether it's therapy or
Yep.
something as significant as TMS, then, we just get them to the place that they need.
That's amazing. That's amazing. So you've had your practice since Jan. How long have you been practicing medicine?
So I've been practicing medicine for 13 years.
Oh,
Uh,
wow. Good for you.
yep, yep. I have worked for St. Vincent's. I have worked for Baptist. Now I work for myself.
Yes, there you go. Yeah.
So I've been in the area for quite a while. And like I mentioned before, I've had, surprising support even from the hospital systems. I've had liaisons reach out, and they're very supportive. They want to help us be able to care for our patients in the best way, connecting me with specialists in the hospital system, with imaging, those kinds of things to troubleshoot, what can sometimes be a barrier for
Mhm.
patients,
Mhm.
getting things accomplished. So it's been really exciting to see just that support in the community as well.
Yeah, that's great. And I would echo that as well. I feel like more and more people are learning about the benefits, and they just recognize, it's just not something they could do. It's just not a part of the system. And so I know they're really appreciative of what you're doing. And when I've worked with Dr. primary care practices in the area before, as well as patients, one of the examples that I really like seeing is that when a patient has blood work, they receive this panel of blood work, and they have these ranges, right? They have the greens, the reds, the yellows to figure out, okay, like what's in range, what's not in range. And oftentimes, what I've seen in the traditional healthcare system is that it's uploaded to a portal, and the patient just kind of tries to decipher it. And if something's wrong, someone's going to maybe reach out to them within the next couple of days. I know that experience is different with you, right?
Yeah, it's really fantastic. I've really enjoyed, we do actually draw labs in the office now. So my patients love that. They don't have to make an appointment at Quest that's going to take them weeks to get into, or LabCorp.
Hey.
So we can send, even though we don't take insurance,
Yep.
we can use patients' insurance to send their labs out with that. And then also for my uninsured patients or patients with a real high deductible, some of them will choose to use our client bill pricing. So we get a better deal on labs if I pay for them and then the patient reimburses me for those. So
Sure.
it's been really fun to do that. And yes, the labs come back super quickly to me. And usually, I mean, if I don't see it, my office manager slash MA, Emily, she's fantastic. She'll
Yeah.
text me, like, hey, did you see so and so's labs are back?
Sure.
And we'll have them, to the patient within a couple of hours of them having resulted, which is pretty cool. Um,
Yeah.
Patients love that. They love not having to wait a long time. It is a little funny occasionally, a send out test that has to go to like a far off lab in California or somewhere.
Yeah.
They might take a couple extra days to come back. And so that they're so used to them
Yeah.
coming back quickly, they'll call me like, are my labs back? I'm like, oh, sorry. This one's going to
Yeah.
take a couple extra days. It
Yeah.
might be 3 instead of, or 5
Sure.
instead
Sure.
one. So yeah, it's really great. And we don't, yeah, I never mind, even if they did happen to see them before me. I never mind, patients will just text and say, hey, I saw my labs and I have this question. I'll just text them back. And again,
Yeah.
that's kind of the beauty of direct primary care, that we can do that.
Yeah, I love that. And just seeing the patients, the feeling that they get to have that communication and those questions answered. I try to get people to stay off Google all the time, and having that connection, they know, oh, you're my go-to resource, not this. And so, having that is, you can't almost can't put a price on it. Like, it's amazing. It's
It really is.
Yeah, it's the way that it should be, and I will say that almost all providers, they want to do that in the systems in the system-based care, but they just can't. It's just not part of the process.
Exactly.
But now that you're doing it, it's amazing. And Emily, I would say, is great too. She's been amazing to talk to and very kind. And so you've got a great office, a great location. It seems like you're doing really good things. You're treating, the people definitely need help, but then you're also working with people that are healthy, that just want to stay healthy and really value their care. So you're able to meet everybody in the middle, and I appreciate that. And it's great to have you as a resource in the Nocatee, Ponte Vedra area, because there really hasn't been that many people in this space yet. So I'm really excited to see what your future holds for you and your practice.
Thank you so much. I really appreciated this and all of your support, truly.
Yeah, yeah. Well, there's a lot of us out there trying to push people your guys' way. I mean, it's what people really need, especially in the people that we are like, okay, like the system's done you harm. Like, you have not done well in this. And unfortunately, that's just the way it is. But if you're looking for something different, this is the something different. I can tell you that it's the something different. And then they're like, well, how does an appointment go? I'm like, well, you set an appointment. You're probably going to wait in the waiting room 30 seconds or so, and then you'll go and you'll have your appointment and you'll have all of your concerns answered. But again, go in with your list of things that are important to you, and just trust that Dr. Marquez is going to be listening to what you have to say, and then understand that, like, there's going to be some homework and some accountability, and she may ask you some hard questions just because she cares about you. And so I think it's great, and the people are really blown away by that experience.
Thank you. Thank you. Yeah, it's fun. I just love being able to be what patients hope for in a doctor, and
Mhm,
not just,
mhm.
the same disappointment of a
Yeah.
difficult system to navigate.
Yes, I mean, I had someone yesterday, just they've sent the same message to the doctor like 3 times in a row, and unfortunately, it's just not getting done. And I'm like, they don't like to hear it, but I'm like, like, the way it is, like, they don't get paid for that. Like, it's not something that that is measured and gets done. It's more of like they're just doing it because that's what they should be doing, right? And so a lot of
Mhm.
providers out there are experiencing burnout and being stressed and pulled in many, many ways, because that's the expectation. But when you step out on your own, no more of that, right? They get a
Right, right,
better
right.
experience. And so, okay, well, I've really appreciated learning more about your practice. I'm excited to stop by and see the place soon, and
Awesome.
just kind of keep working with you and Emily, and just making sure people receive good care.
Thank you so much. I really appreciate it.
Yeah, yeah, my pleasure. Well, I will be in touch very soon, and if people want to make an appointment with you, what's the easiest way for them to do that?
Easiest way is just to text me. You can
Oh,
use
there we go.
absolutely, yes. Best way is just to text me. So the
Mhm.
office number,
Okay,
which to my cell is 904-822-7827.
nice.
And my cell, if you prefer just direct to my cell, is 850-459-7560.
Perfect. Well, you're very kind, and I know that people are going to be excited to work with you. So I appreciate you taking the few minutes to chat.
Absolutely. Thanks so much.
You're welcome. Enjoy your day. I'll be in touch.
You too. Okay, bye.